bed inpatient. Although in terms of outpatient, you could see that we would definitely not have a limited number. But for now, the facility will be able to cater for 54 inpatients. And we're hoping, since this is for a start, as we grow on, after we should have seen how it operates, we are hoping to make other plans, because the challenge that we're having in terms of the drugs and how we are managing as a province, it is a concern for us as government. That is why we've got over probably 250 patients from Limpopo that we've referred to, some in Gauteng and others in other provinces where they are receiving inpatient care, because we don't currently have this type of a facility in the province.
You've mentioned something about recruitment. How soon will that process start?
As I've indicated now, when we live here now, we're going to sit down and look at, because the staff establishment is already there, the structure is there to show that how many psychologists you require, how many psychiatrists you require. And also remember that we have trained our occupational therapist here next door in Seshego, our psychologist also in Seshego, who will be available to be running also these facilities. Now, in terms of recruitment, when we live here, we are going to start the process of advertising.
And others already they have been appointed.
Yes, there are those that are already appointed. But the important thing is that when we live here, we will make sure, and what is important is that come the 1st of October, patients, when we start to admit them, there will be employees and workers to look after them. That take our words on.
The question on the construction started a few years back, and I'm sure that's why the DA came out and started making the allegations it made. Why did it take so long for this construction to be completed?
I think what we can indicate is that the DA it's just jumping on the wagon. We are the ones who went even to the legislature. We went to the portfolio committee. If you remember our budget speech, we were very clear. We elaborated a lot about our Seshego Treatment Centre to say we had already, if you see IDT here, we've already had a meeting with IDT and also the processes of advertising, and we were there with them. We were open and transparent. Now, of course, the DA sits also in the portfolio committee. Now they grab some of these things which we ourselves have come up to talk about them, to say they've been a challenge. And now they run to say, calling their masters from Cape Town to come and say we are doing some inspecting on something that we ourselves have said it. We made that diagnosis. I think what we can simply indicate to you to say the institution indeed, it has long been sanctioned, to a decision to build has been done some years back. But if you remember, at that time there was still health and social development as one, and at some stage we were put under Section 100. When we were put under Section 100, infrastructure stopped. It's not only in health or social development at that time. Not only this facility. If you remember, Letaba Hospital maternity ward was stopped, Middelburg Hospital was stopped, Fort Hare Hospital was stopped. Now, when we came in after the whole Section 100 as a department, not only for this infrastructure, even in those ones in health, that's how I would even be familiar. We started to look at a plan on how are we going to start to build. So this one was mainly delayed by the Section 100 in the first place. And then secondly, when we were failing to pay and all that, there's been a lot of conflict and disagreement with some of the contractors. We had to, now most of the infrastructure, after the whole issue of Section 100, they were now handed over to IDT as an implementing agent. If you remember, not so long, you will be invited to go and open Fort Hare Hospital, which is also part of that package, while it was health and social development when we started them. But now, even if the two departments have been separated, but we still continue. The tender was December. We advertised to look for a contractor who is suitable, because once bitten, twice shy. And unfortunately, IDT came to me and said, MEC, you're making a lot of noise about how we are appointing non-performing contractors. From this, when we look at the people who have been bidding, none of them can meet the requirements and fit. Must I say just appoint? I will not say that. Then I said, let's go back to the process. That's why the process has been delayed for this year. It could have been, we could have finalized by May or April, but the delay was as a result we could not find a suitable contractor in December when we advertised. Now the suitable contractor has been founded. You can see we are with them. They've already started the work. There's clear plan. These issues that I'm raising here, we've already presented them to the portfolio committee. The DA is aware. We have told them. That's why they are coming. You see, where they are not aware is that we didn't go to with a detailed report why we are having a swimming pool, for instance, why we have such type of furniture. That's why they're asking that, is the swimming pool going to be a fire pool? And we still repeat, that is part of therapy. And had they come to us and asked us, we would have been so humble and say this knowledge that we acquired after so many years of studying, paying a lot of money, will provide to them for free. And we were going to provide this knowledge for free. But however, they chose the other way. So the issue is not raised by DA. That I must be clear with you. Go and check our budget speech. We've spoken about these issues. Go and check our appearance in the portfolio committee. We've spoken about it. So it's not like, and even the visit has been planned long time ago to say the MEC needs to go and visit. Immediately, you go and read the minutes. So they jump because they knew we'll be at the policy conference at that time. And